4 minutes.
4 minutes.
4 minutes, oh, okay. I might do this in 3. Okay, well, thanks very much for inviting me to participate in this. So my perspective is as a clinician and an investigator. I'm a nephrologist, and a substantial focus of my clinical work has been in end-stage renal disease, and my research has been in dialysis. And I've been involved in clinical trials, both traditional, or I'm going to start to call them non-real world clinical trials, explanatory trials, as well as more recently in real-world trials, pragmatic clinical trials, as a principal investigator for one of the NIH Healthcare Systems Research Collaboratory pragmatic trial demonstration projects. So as I was listening to these presentations, I was kind of thinking about them from, in terms of conducting randomized trials that are incorporated into clinical care delivery. And I have lots of comments and reactions and questions, but I thought I would focus just on 2 things. The first is the challenge of engaging clinicians and healthcare systems in clinical research, research embedded into clinical care delivery. And the second one is the challenge of sustaining the infrastructure that's kind of created for doing these pragmatic trials from one trial to the next. So starting with the first one, as I was listening to the transcatheter valve therapy presentation, and I saw that the people were collecting 400 data elements. I thought, wow, how on earth do you get people to do that? And then I remembered that you said it's mandated if you want to get paid for the presentation. But nonetheless, so people do things if they're mandated. But that led me to the question in my mind, and this is a provocative question, so I'm not sure what the right answer is, but can you mandate clinicians, for example, to participate in randomized trials or in other research efforts when payment isn't tied to their participation? So that's kind of a question for the group. And at first glance, I would say that doesn't really seem like an appropriate solution. Feels funny, but we do think I think it leads to the question of how can we incentivize people to participate? And mandating it doesn't feel quite right, but incentivizing maybe does. So that's my first comment. And then the second comment is about the sustainability of these infrastructures. And I think earlier today, I can't remember who said it, but somebody said that, I think it was Patrick Valance, said that the design of the trial really should be based on the question that's being asked. And I think you said the same thing in your presentation just now. And so that made me wonder, well, you've put all this effort into the Salford lung community, physicians carrying out this trial so successfully, and I wondered how you got 3,000 people to get trained in good clinical practice and all of that. And so, are you planning to do, or is anyone planning to use that infrastructure? Maybe it's not your company, but maybe it's somebody else, to kind of recycle that infrastructure and use it for a next pragmatic trial. So I'll stop there.